Hi, my name is Dr. Lalani. I'm a board-certified anesthesiologist as well as pain management. Today we're here to talk about ketamine. It's an amazing new drug for the treatment of chronic pain as well as depression. Okay, today we're here with a patient who has been undergoing a series of treatments with ketamine, and I wanted to discuss, and she could kind of go over with you guys in terms of what her experience has been. First, tell me about your struggle in terms of the pain, depression you've been experiencing.
Okay, about 22 years ago, I was diagnosed with thoracic outlet syndrome, which I got by from typing, overuse of my hands. I'm a writer. I'm a compulsive writer. I mean, I love what I do. I read books. I was a journalist before that. And I'm thin, and I was not muscular at all. And I would curl up in a little ball like this, and I got my laptop, and I would do this, and so everything just kind of fell apart. And the brachial plexus nerve bundle got compressed at every point it could possibly be compressed. And I developed, nerve damage, I guess you would call it. And my arms felt like they were on fire. My fingertips felt like they had burst into flame, like cigarette lighters, And I reached a point where I couldn't lift my arms. And I had a child at home.
Interesting.
I could not get my cup into the microwave. I
Okay.
couldn't take care of my child or myself.
Okay.
And that, I did not seek help until I was at that point.
Got it.
At which point there was a waiting list for the few doctors in New York who understood this, because it had hit the New York Times newsroom and the Newsday newsroom, and there was a long waiting list.
Got it. What did you try before ketamine?
Before ketamine, I tried physical therapy, which I had been doing since that diagnosis, which was very helpful. And a method particularly called active release technique. And I'm in it now. I don't go out of it even when I feel better. I just stay in it permanently. Weight training, essential, huge help. And various medications. The one that really helped me was Lyrica at high doses.
Got it. How did you first learn about ketamine?
From you.
Okay.
And it's made a huge difference, so I'm very grateful to have learned about it.
How's your experience been with the pain healings to ketamine?
Fascinating.
Okay.
And it's made a big change in my life. We did 6 infusions last year, with intravenous. With my being on a gurney for, maybe 4 hours. Last year I was more not quite aware of the hallucinogenic aspect of it because I was afraid of it, and so we used more anesthesia. And this year, your advice, I really have trusted the experience more and given myself, given into it more.
Okay.
It's been fascinating, and it has helped. It helped last year.
Okay.
It helped this year in a number of ways.
What is your pain level now? Would be after the 5th infusion. What is your pain level now?
Lower.
Okay.
Just lower. I can live with what I have.
Okay. All right.
For a number of reasons. It's not just because the pain is lower. It's because my anxiety level about the pain is lower. It's just changed. The way I live with the pain has altered profoundly because of the ketamine.
Okay.
So even if the pain level is not down, it's never going to be normal. This is a chronic embedded condition.
Okay.
I always have some degree of pain. It just does not affect me the way it used to.
Okay. All right. If someone is on the fence about getting ketamine, what are some of the questions? What would you have to say to someone?
Well, probably 3 things.
Okay.
I would say, first of all, can you get a prescription for depression or for pain that would help your insurance company cover it? Because it's not cheap.
Okay.
And even with my insurance company kicking in, it's not inexpensive, and I'm grateful that I can afford it. We do 6 infusions a year over a 3-week period, and at your suggestion, I'll probably do a booster once during the year. And the second question, but it's worth it to me. I would give up other things to do this. The second question is really discuss with your pain doctor what the hallucinogenic aspect is going to be. I understood what it might feel like because I grew up in the 1970s when people were doing drugs, and I tried LSD, and I know what it means to hallucinate and to undergo, a trip. And I still found part of it really frightening. And last year when I called out, you came into the room and you upped the anesthesia, and that was fine. It's not frightening this year.
Okay, excellent.
But so I would say ask about that and find, do a little research and find out about it, and also trust in it. Just know about it first. And then the third thing I would say is, once you feel you can handle those two aspects, I think it's terrific. It's helped me with cyclical anxiety, where I dwell on fear of the pain. What if I can't walk because my feet hurt so much? What if I end up in a wheelchair? What if it then hurts my thighs from the sitting? Well, what if I then can't stand or sit? And what if, and that's all gone, all that panic. So if the panic's gone, so, then my foot hurts, and then I learn how to look, okay, so my foot hurts, and I'm going on living with it.
Thank you so much. So that was excellent. And you could hear more about it. Give our office a call, the Pain Healing Institute, and we'll discuss ketamine, how it's amazing treatment for depression, chronic pain, anxiety.
It really
Thank you very
is.
much.
Thank you.